Sessions podcast.
I'm Emily Satel. I'm a licensed professional counseling associate, supervised by Venus Rohani, and I have been working with Transcend for almost a year now. It's been like 11 months.
Well, we can start in a lot of different places, but I know that you just finished around 500 sessions. Probably don't have a perfect calculation on it. It's somewhere in that ballpark. About a year of experience doing it, but doing it full time, which I always kind of point out is very rare. Most therapists, if they do ketamine assisted psychotherapy work, they will do it maybe like a day a week and they hold a private practice. Doing KAP full time is not the norm. It's very rare, and Transcend, we do allow some people to do this more full time. And so point is, our therapists that do work KAP full time, they end up with a ridiculous amount of experience in a very short period of time. So a year doing this is actually a lot. There's only so many providers in the world that have actually done at least 500 sessions. So that's cool. Yeah. But I like to get in just like reflections along the way from 500 sessions. But I kind of like to start before all of that and just kind of maybe start the conversation with just why you even got involved in mental health in the first place.
Okay.
If you can figure out a way to share that.
Yeah. I mean, I think like most people in this field, I became interested because of my own mental health journey and struggles with anxiety and alcohol abuse. Runs in my family, so grew up in an alcoholic household. And when I was maybe 22 is when I got sober and I really started doing my own really intensive therapy and started to work through my own stuff. And at that point I had my bachelor's in psychology, but was not at all prepared to be a counselor because I hadn't done my own work. And so I did years of therapy, met with a counselor weekly for 5 years and worked through a lot of my own stuff and got to a place where I was like, man, okay, it actually is possible to get, to a healthy and happy space where anxiety is not running my life. I, at this point, have 9 years alcohol-free and really learned healthy coping skills and how to kind of just accept myself and love myself, and wanted to be able to pass those tools on to other people. So initially, after I got my bachelor's, I was working in diagnostics, diagnosing people with different neurocognitive disorders and mental health conditions, but really just kind of wanted to be a part of the healing side of things too, the helping in that way too, and to see people for more than just, 5 hours of testing. And so I decided to go back and get my master's in counseling, and it's been amazing. I think just being able to work with different clients, especially in ketamine therapy, has been very rewarding. And I think my own experiences has helped give me a unique view that has been beneficial to some of the clients, definitely. So.
Did you expect to go straight in to something like this right out of therapy school?
No, I think...
I always say therapy school.
Yeah. That's what we call it. But yeah, no, I think this was maybe a pipe dream that I had of one day being able to work in psychedelic therapy. Because, I have been interested in being a counselor since high school. I remember taking a psych class in high school and thinking, I'm really interested in this. This is what I want to do. And starting to read, some of the literature on the studies that had been done on different psychedelics and how effective they were at treating mental health illnesses. But at that time, with the political climate and just the unpredictable nature of this field in general, Just didn't think that that would ever happen. And so, yeah, in grad school, kind of met a couple of other people, very few people in the grad program that were actually open about also wanting to work with psychedelics because it's still a little bit taboo and hush hush. And that is how I ended up, going to the Psychedelic Science Conference and getting connected with Transcend. So I feel very fortunate to have had that happen because, yeah, again, just after having done more traditional talk therapy with clients suffering from really severe mental health struggles, switching to seeing similar clients in this setting and watching them make such amazing progress in a matter of weeks is, I mean, it's kind of miraculous. There's nothing short, there's no way of explaining just how incredible it is to see how quickly people are able to make progress and move from a space of feeling like they don't even know if they can go on living to like actually being able to enjoy their lives again. So at this point, I can't imagine going back to doing just traditional talk therapy alone because it just felt like when I was working with clients in that setting, there were tools that I knew were available, but I couldn't use. And it was incredibly frustrating just knowing that I could be helping these people so much more if we had access to psychedelics. And so yeah, very, very blessed to be in this space.
So if you hadn't found yourself here,
Mm-hmm.
what do you think you would have done?
If
What
I
would have been
hadn't
your
found,
move?
like if I hadn't found myself here as a counselor or like,
Yeah, what you would have focused on?
okay,
What would have
right,
been?
yeah. So if I had stayed with counseling but not been in psychedelics, I probably would have. I mean, what I was doing was specializing in complex trauma. And developmental trauma really was my focus in grad school. I did a lot of research on that area as well. And so I think I would have continued to move in that direction. I'm also really passionate about working with people who struggle with substance use disorders and anxiety disorders.
So I got to slow you down because some people don't know these terms.
Okay.
So complex trauma,
Mm-hmm.
this concept, what are we
Right.
talking about?
Yeah. So when you think of like PTSD, sometimes people just think of veterans or like really significant single incident traumas like a sexual abuse or like, a major medical event or natural disaster. But complex trauma is when there is kind of more of a repeated pattern of traumatic experiences. And sometimes these are like big T traumas, as in, again, like sexual abuse and those things that people automatically think of, physical abuse, things like that. Other times it's just repeated neglect and emotional and verbal abuse that over years just does damage to someone. So that can come from abusive relationships with romantic partners or oftentimes from growing up in a family that is not necessarily equipped to give their kids the tools that they need to thrive and survive. And so these clients are growing up in a household where oftentimes their parents can't regulate their own emotions, so they can't teach their kids how to regulate their emotions, and you end up forming a view of the world as not really being a safe place. Other people aren't necessarily safe. You don't know kind of where you fit oftentimes in the world and how to truly be yourself. It often leads to problems with, like being able to regulate your emotions and like calm yourself or step away from anger or anxiety and things like that. You can get kind of consumed by those emotions and react impulsively. It leads to difficulty in relationships, and oftentimes people who have suffered this type of trauma find themselves in abusive relationships because that was normalized for them at a young age, especially if they grew up in a household where they were experienced some type of abuse. And also because it can lead to a lack of self-esteem and low self-worth. And so,
Do you think you could say more about that? Like, common pattern where you very often find that somebody who has maybe been in one abusive relationship might find themselves in another.
Yeah.
Where there's almost like a repeating, to this theme.
Right.
Go for it.
So sometimes this starts in childhood, but not always. I don't, think that mom and dad are not always to blame, but sometimes mom and dad, yes, make mistakes. We're all, human beings doing the best that we can with the tools that we have. And so sometimes it starts there at childhood. You're seeing an unhealthy dynamic between your parents, and that teaches you that, okay, that's what a relationship looks like. Is it's okay that there's screaming going on and cussing each other out, and sometimes even it's okay if there's physical abuse. And so it kind of sets this standard of like, this is normal, this is what a relationship looks like. And sometimes, again, it could be more subtle, like emotional or verbal abuse or neglect of needs, things like that. And so when that's what's modeled for you, you tend to not recognize if you're in a relationship where someone is not meeting your needs, where they're being emotionally manipulative or verbally abusive or abusive in other ways. It's kind of like, oh, well, this is the way that relationships are, because that is what I saw in my childhood. And so once you've been in one relationship like that, again, it just reinforces that. And so you kind of become desensitized to it and just, again, start to normalize it. And then I also think that there is, oftentimes in these relationships, it's not all bad. There's like little sprinklings of, like really feeling validated and affirmed by your partner one moment, and then in the next moment they might be abusive. But those moments where you do get that validation, it can be so important, especially when you didn't have those needs met as a child. You really can kind of become dependent on other people for that. And so I think that can lead to a pattern of getting into unhealthy relationships until you start to work on kind of really mending those childhood wounds and building up some self-worth and self-love, so that you recognize what you deserve out of a relationship and aren't willing to accept less than that, so that you can set those healthy boundaries from the start and recognize, like, if this person is crossing those boundaries and is being abusive, I am not going to accept that because it's not normal and I don't have to accept that. But when it's normalized from a young age, then it's really hard to even recognize that there's something wrong with that. And so, I think that hopefully answers your question.
Yeah, I think it's really confusing to some people. And I think before I had much psych experience, I just didn't really understand the nature of it. It almost just kind of felt like, some people maybe were just out there searching for it, because obviously I guess a less educated opinion of it would, maybe come up with that, but I think being around it, the pattern started to make a whole lot more sense. But I guess in relation to just continuing on the theme of complex trauma, we see a lot of patients with complex PTSD here, and I think the trajectory of what one's treatment will be like if they have complex trauma versus maybe they have an isolated traumatic event in their adulthood can really be different.
Yes.
What have you seen?
Yeah, I mean, it's completely different. If it's an isolated event, especially an isolated event, you can kind of understand more. It's one thing that you have to wrap your head around. So we process that event, and it doesn't. If it was, for example, like a car accident, it might lead to some anxiety and aversion to driving and things like that. But we can typically process that more quickly because there isn't this long-standing pattern of, there's other supports in place. You've had maybe that more secure upbringing. You have, more positive experiences, versus with complex trauma, a lot of the times people who've experienced especially more severe complex trauma, a lot of their experiences have been, not being supported, not having their needs met adequately, not kind of being taken care of in the way that they needed. And because these things are happening repeatedly, it's not as simple as just that was a car accident, that was something that happened once, it was a freak accident. It becomes more of a world view where it's like, okay, well, most of my experiences over the past years in this relationship or throughout childhood there were a lot of really bad experiences. So that means that the world is not a safe place. And my nervous system is also starting to respond to that because, so for example, if you grow in a household with abusive parents or with parents who struggle with addiction or something like that, you don't really know what your day is going to look like. So you might have days where everything is great, mom and dad are happy and things are good, and then the next day out of nowhere there is just a lot of violence or screaming. And so you kind of learn to walk on eggshells, and essentially that just means your nervous system is kind of learning to always be prepared to be in fight or flight. And so that leads to just this really uncomfortable feeling of anxiety, and a lot of people with complex trauma get diagnosed with generalized anxiety disorder because of this. It's just this feeling of, I don't really know what I'm anxious about, but at any time, like, something bad could happen. So your body is prepared for that because you've experienced so many of these negative events that that part of your brain that is just trying to keep you safe and keep you alive wants to be on high alert at all times because it's learned that it needs to do that. So yeah, it becomes more complicated because we are having to process those traumatic experiences, having to introduce new ways of kind of starting to trust yourself, trust the world, trust other people. And also implementing ways to learn to regulate your emotions because you never really had the ability to do that. I mean, oftentimes, especially if you grow up in a really abusive household, your system does need to be in fight or flight. There's a real threat. There's a real danger there. Even if it is verbal abuse, a kid doesn't really know that they're not in physical danger at that time. It can be perceived the same way. And so yeah, your system learns I always have to be ready. And so now you're coming in years later and your nervous system is still operating in that way, even if there's no longer a threat. And so we have to teach you to start trying to regulate and ground yourself and become more comfortable with those sensations of kind of just being anxious, and learning to ground through, different types of body work, exercises, breath work, somatic therapy, all of these different types of things. And so usually it's more robust care, more holistic. There's a lot of other things that we're going to be working on beyond just looking at the traumatic events, because oftentimes there are a lot of traumatic events and you have to now also learn the skills to essentially retrain your brain to see the world in a different way. So it's much more complex versus someone with a single incident trauma. They might have a view of the world as a generally safe place, but then this bad thing happened, and that doesn't necessarily mean that the world isn't safe. It's just this was a freak incident, versus when someone has that repeated history of trauma, it's, well, no, this is just the way the world is, or I must be broken and doing something to cause this, or other people aren't safe, something like that we're kind of working to start to change those core beliefs into something that is a little bit more open and realistic, where you're still keeping yourself safe, but also not cutting yourself off from being able to actively participate in your life because you're so afraid of, getting hurt that you can't really go out into the world or form relationships or whatever that is.
Yeah, one of the distinctions that I've kind of thought a lot about is just trauma that occurred within the period of time where your brain is developing versus period of time where it is done developing.
Right.
The brain doesn't really fully stop developing till we're about 25 for most people, and there's even things that we can do that can delay that to some degree as well, and even push that out. But when we've had really pervasive trauma throughout that entire developmental window, trying to get the nervous system to respond differently to different stimuli can be much harder than someone who experienced a traumatic event after the brain is, to some degree, a little bit more solidified.
Right.
And so the impact to the nervous system seems to be quite a bit different in people with more childhood trauma. But again, the brain not even being done developing till 25. So, childhood 25 and below. So the other piece of this, so we tend to see a little bit more dysregulation along the way with someone with complex PTSD as they go through KAP. If we're diving into those things, as well as even if that isn't the content of sessions, it can be just different for someone with complex PTSD to go through ketamine assisted psychotherapy. So sometimes we have to pace the sessions a little bit. Sometimes the nervous system hasn't really fully recovered from the last session, so we have to be very mindful about when we do these sessions and not just proceeding through it some kind of standardized protocol. Which is what I see in a lot of ketamine clinics in America, is they're just like, you're going to do 2 weeks for 3 weeks, and then we're going to be done, and then that's the magic number, and then you'll be cured 100% of the time. That's what the story they kind of purvey.
Yeah, that's very dangerous, because trauma processing, there's an art to it. You can re-traumatize someone by moving too quickly, essentially. And so you do need to make sure that you're spacing these sessions far enough apart to where, they have enough time to kind of regulate in between these sessions. And so really diving into some of the most, traumatic experiences of your life 2 times in 1 week is too much for most people. Oftentimes when we are processing trauma, it feels like things are getting worse before they start to get better. Because in some ways you are, almost reliving some of these experiences by talking about them in therapy. And you are, oftentimes when you're going through the traumatic experiences themselves, you're just focused on survival, and so you don't really have the space and capacity to really feel the emotions around it. And so when we're processing these things in therapy, it gives space for those emotions to start to come up and for you to really kind of feel all of those things, the fear, the sadness, the grief, whatever is there, the guilt. Oftentimes people with trauma have immense guilt and blame themselves for these things. And so we're processing these things, we're working through these things. But following that session, if I've had a particularly challenging session with a client where we have been processing something traumatic that they experienced, I'm checking in with them the next day. We're going to have at least a 15-minute phone call, if not some type of integration session, to make sure that, they have the tools that they need and that they're not too dysregulated. Because sometimes after a session like that, people feel lighter, like they got something off of their chest, like that has been there for a long time. But oftentimes it does kind of it's something that they have been avoiding looking at for so long that, we're looking at it now, and it's not comfortable to look at these experiences. And so giving them some space to continue grieving what they went through for a few days after that session, and doing an integration session to continue processing that outside of, the psychedelic space, which is incredibly helpful for processing trauma, but is very intense. And so having talk therapy afterwards to just kind of make sure that you have those skills and that you're regulating in the way that you need to, and that you're having compassion for yourself if that means, that you have a few days where you are just kind of feeling really bad and maybe have to miss work or social engagements and kind of just really take care of yourself and rest. That's not a bad thing. You want to show, oftentimes when we start to process these traumas, your nervous system can kind of become dysregulated because you're thinking about something very scary. It can be a little bit triggering to talk about these things, and we go about it in a way to where we try to make sure that we're not going beyond what is within your zone of tolerance. Nothing that's going to push you too far and be re-traumatizing, but it's still uncomfortable. And so oftentimes after that, you might need to just really allow yourself to rest because your nervous system is kind of on high alert, and using sensory cues, like, having soft lighting, if that's what you like, having calming, soothing music, like being in a space of your house or outside somewhere that feels really safe. These are all cues that your body picks up on that can start to tell your nervous system, I am safe. It's okay to kind of come out of this shutdown. And then once you are in kind of a more regulated space again, then we can start to kind of go back into the trauma processing. And so it looks different with every client, that rebound period and what those days after the processing looks like for them is there's not really a good way of predicting what it's going to be like, but that's why I always make sure that I do check in with clients, and I always recommend very strongly that every single client, whether they have a complex trauma history or not, is doing integration therapy throughout their ketamine series, because the ketamine is not going to magically fix anything. This is hard work. It is not always a comfortable process, but it's in those uncomfortable spaces that there's the most room for growth and healing.
Yeah, it actually, I feel like there is a large amount of providers out there that may be able to be fully capable of safely administering ketamine to people. Mm-hmm. They have some experience and background in that, but the complexities, nuance associated with bringing someone with complex trauma through ketamine treatment with no therapeutic support, with no measure on how dysregulated somebody is to know whether it's time to hit the gas or whether it's time to hit the brake or take an extended break or whatever it may be. And just a fully kind of unsupported thing, it scares me because I see these comments online constantly from people who, it's like you can see what's happening even though I don't know anything about this person. This is clearly a person with complex trauma experiencing a significantly dysregulating experience. And what they ingrain is that there's something wrong with them because the way that they're going through it is not the same as the way that somebody else that they know went through it.
Right.
And so I think that, I mean, I'm always going to be an advocate that people who have mental health disorders and are going through a mental health treatment should be supported by mental health providers. It feels really basic and something that shouldn't have to be said. But unfortunately, the majority of people who go through ketamine treatment aren't supported by mental health providers, and they weren't assessed or screened by mental health providers. They were screened by people who have great medical backgrounds, but truthfully can't tell if somebody, because even if somebody had significant childhood trauma, that does not necessarily mean that they have a complex PTSD diagnosis. The history alone isn't enough to know whether or not this person meets that criteria and will respond in that way. But it's very clear to a therapist that works with people with complex PTSD all day, every day, where somebody's at in that spectrum. And how they may, go through this process, and can also let someone know before we even get started, hey, this may be this way for you. We may have to stop at different times. We may have to, at times really just focus on, skills that help you with regulation. There may be outside skills like DBT that we need to focus on, but you're probably not going to go through this in the path that you may have read about on Reddit. And that's okay, because your history isn't the same as some others. Now, a piece that I wanted to return, though, to, because I think that a challenge that so many, it's just a common thing to talk about, people sort of feeling as though their childhood was not traumatic, or not being able to see maybe why they have complex PTSD in response to their childhood, where maybe many things were correct, but there might have been certain omissions. And there's not any blaring examples of abuse, no physical abuse, no sexual abuse, but meanwhile they have clear symptoms of complex PTSD.
Yeah.
Can you speak to that situation?
Definitely, yeah. I think that people, just don't have a good understanding of especially, again, talking about developmental childhood trauma, of the needs that kids have. And there is a fundamental need that we have for more than just having our physical needs met. We need more than just physical safety. We need more than just food. Of course, those things are helpful. Obviously, we wouldn't survive without them. But kids also need to feel loved. They need warmth and engagement. They need to feel supported. And so if you grow up in a household where your parents kind of just don't seem to care about you, or even feel like maybe you are a burden to your parents in some way, that does some significant damage. And then verbal abuse, again, as I was saying earlier, like especially with young children, you become really dysregulated when you hear people screaming in that way, and it doesn't feel safe, because it's not safe. There's a lot of anger there. You can feel, we co-regulate with the people around us, and so that means we pick up on what their nervous system is sending, and our nervous system starts to kind of mimic that. And so if our parents are really dysregulated and angry and screaming, it signals to us on a lot of different levels that we're not safe. And so, this is what you were talking about earlier, about kind of it wires your brain in a certain way to kind of pick up on these little stressors a lot faster, and to be hypervigilant, to feel like you need to walk on eggshells, and to feel like you need to earn your keep at home or something like that. And so it can lead to a lot of the same types of issues that you see with clients who did experience physical abuse in their households. The same type, like complex trauma, is you do not have to have a history of physical abuse or sexual abuse to have a complex PTSD diagnosis. Those other pieces are really important. And it is very damaging for a child to grow up feeling unloved or unlovable.
We see a lot of households that might have even felt like a good example of a perfect household, but the level of pressure to be perfect that was placed on children had such significant damage, and you actually see the same degree of symptom patterns that somebody who came out of a household where they were experiencing very significant physical or sexual abuse, and it ends up looking the same. The net product is the same. And I think that's something that is so hard to recognize, because if someone looks at their childhood, they're just like, yeah, no, I was so supported. I was incredibly supported. In fact, actually forced to be perfect. But it can be very difficult for them to understand why they have these like really insidious symptoms. And that's one of the things too with complex PTSD, is that the symptoms can be very, far and wide, including being connected to chronic pain diagnoses. I don't like the word diagnosis, but
digestive issues, all sorts of immune issues, lots of things.
Autoimmune disorders, and we're still finding out all the things that it's connected to. But what's interesting is when you intake someone with complex PTSD, there's just always this other stuff that is going on for them. They history of drug, alcohol addictions, finding themselves in other abusive relationships. They might have had a really hard time holding down jobs and relationships, seeing a whole lot of patterns of significant continuous chronic or passive suicidal ideation throughout someone's life, more suicide attempts, uh, a significant increase in a propensity for someone to become addicted to opiates, specifically, which is an interesting one, which I think really flags the actual neurodevelopmental changes that are occurring. So in other words, if someone has complex PTSD, they're way more likely to get addicted to an opiate if they're exposed to it. And so, which is interesting, and I think it just flags the fact that that brain has actually been changed by some of these phenomena. And so now, I think the challenge with these conversations is it sound a little bit like a death sentence, if
Right.
with oh man, I had this trauma in this developmental period of time, and now I'm just going to have all of these symptoms that are connected to these diseases, and what can be done. What's interesting is we actually have data that would suggest that if someone is treated, so they have PTSD, complex PTSD, and they have treated, those connections go away. They don't have an increased chance of addictions and things like that if they actually get effectively treated. But what scares me is just how pervasive this is, because I think so many patients that we intake don't have any awareness about the degree of complex trauma that they have, and it's a huge factor for treatment resistance. So maybe they have focused in therapy on a whole lot of things, but actually if you asked them to look at their childhood, sometimes we'll kind of see quite a lot, sometimes not even capable. Literally, I can't really go there, and so that's, for me, a huge indicator for KAP is any time that you've been in therapy and there's actually an inability to access certain things. And generally speaking, I think we could go slightly into a topic I don't think we've talked about yet in the podcast, but just this concept of kind of like a repressed, or suppressed, which terminology you like, but memory of sorts. So sometimes this trauma actually happened in a period of time where there isn't memory, So sometimes we see process during KAP sessions where I've even literally seen examples where I felt like someone was processing something from when they were a baby. It's hard to explain why that was obvious, but even to that degree, that age of processing. And some of this stuff is just pre-verbal trauma that's just still within someone's nervous system, but there isn't anything to discuss. It's more of a physical process. And I think a lot of times people don't really trust those because they're just like, I don't know, I felt a certain way during the session and I don't really know what to make of it. Their body was working something out, but with that still being stored within the nervous system. But anyhow, I think that just kind of understanding that really, really early trauma is most likely going to be processed differently, look different, and just respond different to this process. And just, how many ketamine clinics out there are just not even, none of this is on the radar, within the consideration before saying you're approved for treatment. There's like, okay, you have depression. They ask you 3 questions about it, fill out a PHQ-9. They don't know that this person, yes, they're experiencing symptoms of depression, but the reality is the majority of the symptoms that they're experiencing is a consequence of complex trauma.
And psychedelics are powerful and should be treated with respect. You cannot guarantee that anyone is going to go into a psychedelic experience and have a positive, uplifting experience. And especially when you have a history of trauma, there is, a good likelihood that at some point in your series, that's going to come up. And if you are at a clinic where you are not supported and there's no one in the room, you might have a call button, but ketamine, you're not, super aware of your hands and how to function in those moments. And you can start to have flashbacks. Now, if that happens in a session here, it could be productive because I'm there to help you. I'm there to support you through it. I'm there to hold your hand through it if that's what would be helpful in that moment, never without without consent, of course, but I'm there to help you breathe through it, help you process those emotions and remind you that you're safe, that this is not happening now, and that you have, the tools that you need now to kind of move forward past this. So, I mean, we allow them to experience that trauma in a way where they're supported through it and they know that they're not alone. And there have been many sessions that I've had with clients who are, actively reenacting a traumatic experience that they went through. And I'm there holding their hand and letting them know that they're not alone. And that does just wonders for them, to just be able to be supported like that and to feel like I'm having the support now that I wish that I had had then. And then at some point in their series, we get to a point where they don't need those handholds from me as much because they're able to start supporting themselves. They're able to say, the things that they need to hear to themselves. I am safe. I am okay. Who I am is okay. And I accept myself. And it's not okay that this happened to me, but it's not going to, dictate the rest of my life. I can move forward from this. Now, does that mean that they're never going to struggle with symptoms of, the complex PTSD ever again? Probably not. There will be times in your life where things come up that we might need to have another session to address some stuff that wasn't originally addressed, or where, life sometimes kind of just hits you and these symptoms can start to return. But that's why we follow up with clients regularly to make sure that if they are starting to notice an increase in distress, we can support them through that and make sure that they're getting the maintenance sessions that they need, doing the talk therapy they need. And really, if you do the series that we plan out, if you are really actively engaged in the integration work and the therapy in between, and if you continue on with doing traditional talk therapy and learning some different skills to regulate your emotions, to form connections with other people, then that is going to be a recipe for success. Again, this is not, the ketamine's not going to come in and fix everything. This is a process that involves work. But it's worth doing because you get your life back. So yeah, I think some of the other clinics are not well suited for clients that have a significant history of trauma, because you end up being alone, reliving a horrific experience without anyone there to kind of let you know that you're not actually back in that place, that you are safe. And so it can be re-traumatizing. And that's where it gets very dangerous and honestly just reckless of some of these places that do infusion only. I just don't, I see that as being very harmful to a lot of clients. And I've worked with a lot of clients who have come here after going to clinics that were infusion only. And I'm grateful that they were able to trust another ketamine clinic after that, because it was damaging. And part of what we're processing sometimes is, how horrific it was to do the infusions alone without having adequate support. But then they make, great strides working in this environment because they do have the support that they need to kind of get through these more challenging sessions.
Yeah, I always get curious how much of it is, in fact, maybe we elicit, this response within the nervous system, or it happens kind of more organically during the process because we create a safe container where this can come up. Mm-hmm. And ketamine tends to have this effect where it just allows these things to come up out of the unconscious. But how much of it is, in fact, the verbal processing about this, or even just kind of re-experiencing it, and how much of it is this more physical process where someone is in a safe container. And since ketamine has this ability to kind of disrupt the reconsolidation process of traumatic memories, what we're kind of, if we were shuffling a deck of cards, we're kind of mixing a very safe container, well supported, in a perfect format, with very traumatic experiences. And the brain kind of goes, okay, well, how should I file these things away? With this new experience around these things, where I was actually okay. And I think mechanistically, we're going to probably find that that's a huge piece of it. And so if you just go through it alone, I am concerned that it's possible that you're actually kind of concreting in a really bad pattern
Right.
where, okay, yes,
Mm-hmm.
and when this type of content comes to me and impacts my nervous system, I'm alone.
Mm-hmm.
And I just don't see that as something that you want to ingrain into your nervous
Right.
system.
Right.
And I think just, we see this where people go through it, and the challenge is a lot of times, what was the actual intervention in that moment? Oftentimes support. And it's like,
Mm-hmm.
quantify that. A handhold, just
Mm-hmm.
knowing that you are in fact actually okay being around another person who is empathetic in that moment.
Yeah.
That's something insurance companies are not really good at seeing as useful.
Right.
And so that's one of the challenges that we have with, people kind of accepting KP,
Yeah.
and so, but the other piece of it is, a lot of people are really averse to the idea of revisiting these things,
Mm-hmm.
from their childhood. And what I would also say is not every person with complex PTSD or PTSD actually finds themselves reprocessing
Mm-hmm.
old things. Very oftentimes it is, what is the current impact in my day-to-day right now? And working on skills.
Mm-hmm.
And that is all that is needed. We don't always find that we have to trudge through the mud. There might be a really important phase of something that's never been revisited that actually is still impacting somebody on the day-to-day. But it's not always the case that if someone comes in and they have a history of trauma, that we're going to be primarily focused on that the entire way through the treatment.
Right.
That might not be the biggest thing, or they might have actually really done a good job in therapy for many, many years addressing that. And there's other stuff that's more important.
Yeah.
And so that's something that when somebody intakes with us, the great challenge is, okay, so you've been in therapy for a long time. You've tried multiple medications and different interventions, and you still have significant symptoms. And then we intake you, and we might see you like between 4 and 10 times. And our job is to figure out of everything that's been going on, what is the most important focus that is going to make the biggest difference for you in this period of time. And that kind of sounds like an impossible mission. Meanwhile, somehow, like, we're just constantly achieving that goal. And so that, for me, was very weird, because I would see it happen over and over again. And I've had multiple times where I'm just like driving, and all of a sudden it hits me how strange it is that we're as successful as we are at this impossible mission to help someone who has already not responded to multiple things, and maybe with really good therapists, maybe tried good interventions, got a whole history here. And then somehow we see somebody, and in like 6 weeks, they are in a different place than they've ever been in their entire life. And I'm always just like, how are we consistently that, able to generally produce that? But I just don't think a lot of clinicians are actually minded to try to do exactly what we're after. We know that, in other words, we're trying to get things to a significantly better place as quickly as possible. That doesn't mean the work is done. Somebody may continue on the work a lot, but to make that big impact where someone can get to a much better place of functioning, where they can start to experience that kind of upward spiral in their life, where more things are actually coming on. Now I'm actually able to work again. Now, I'm able to be in a relationship where I'm actually able to have friends. Maybe I've stopped drinking or whatever it may be. Maybe that's a segue to talk about alcohol and addictions with KP, because this is the like logical challenge, right? Like, okay, I am addicted to a substance, and so I'm going to take another narcotic, and somehow that is going to help me. I think a lot of people can't really get down on how that's going to work out.
Right. Well, I think there's a few things like to mention. Firstly, like that we don't prescribe ketamine for people to take at home. And so I think by doing that, we're already kind of making sure that they're using this in a supported and healthy way, where they're they don't have access to it at home. I think that's where it can become a slippery slope, especially with, I mean, every person is different with how much they like ketamine. Some people love their ketamine experiences. Some people hate their ketamine experiences but see how much it's helping them, and so they come anyways and do the really hard work, and they make great progress, and it's worth it in the end. Most people, I'd say, kind of are more middle ground and kind of have some highs and lows. But yeah, so we do make sure that we're not supplying someone who struggles with addiction, or anyone that comes through these clinics, through our clinic, with ketamine that they can be taking at home. And so there's a little bit of risk reduction there. But also, I think people don't always recognize the link between like substance use problems and trauma and, you know, other mental health issues. Usually people are using substances not just because they, you know, are adrenaline junkies and want to get high all the time and want to have fun. It's oftentimes they're self-medicating because their symptoms are so significant. And, you know, when clients come to me and they tell me that they've been struggling with substance use, oftentimes I, you know, think that it's great that they were able to find something that kept them going, because for many of these clients, they would have ended their lives otherwise. And so, you know what? It's not the healthiest coping skill, but you found something that kept you alive. And now we're going to support you and help make sure that we are addressing the root like causes of these of this addiction. And, you know, for a lot of clients, at some point they may need to kind of come to complete abstinence, but for other clients, they can, once they've processed their traumas, come to a place of more moderation. That's going to depend case by case. But I think, you know, AA is incredibly helpful. I would not, you know, be sober without it. It provided me with the community and, you know, some form of structure that helped me when I was early on in sobriety. But I think that AA is not trauma informed, and does not always recognize that. I mean, of course, it's there's no mental health professionals there that are kind of running these meetings. And so you have recovering addicts helping other recovering addicts, and no one should expect someone who doesn't have a degree to know how to help someone completely like work through this process. And so there can be times where programs like AA, as beneficial as they can be, and as much as I do recommend them to clients struggling with substance abuse, in NA as well, and all these different programs, they can also sometimes do damage depending on the group that you're going to, depending on who your sponsor is. There can be messages of shame that are often perpetuated through these some of these meetings. And, you know, again, some meetings are better than others, but you know, it's just working those 12 steps is not going to help you process your trauma. It's going to help you deal with your resentments. Sure, it's going to help you you know, make amends where you need to make amends, and maybe get rid of some of those stressors in your relationships by doing that. But for a lot of people, there is a lot more that they have to work on beyond just the resentments that they're holding. You know, there's a lot more that they have to work on beyond just like, you know, another thing is having a connection to a higher power is very important for some people, but should not be a condition that you have to have this in order to be sober. And so I think that in those ways, some of these more traditional programs are not always the most beneficial for clients. And I've worked with plenty of clients who just felt like I did everything. I did the steps and I just can't get better. And it's like, well, it's because you have this really significant trauma that has never been processed. And, that's something that we need to deal with, because you're self-medicating, and it's understandable that you're self-medicating because your nervous system is always on edge, or you are always in this space of shutdown. So you're doing something to combat that so that you can feel like you can function, so that you can feel like you can survive day to day. And going through a program like AA, you're taking away those coping skills that, again, for some people are, even though it's unhealthy, it's literally what's keeping them alive. It's what's keeping them from ending their lives. And so I think that it's really important to be adequately supported by a mental health professional when you are trying to get sober, especially if you do have a history of these more complex mental health issues and trauma and suicidal ideation. And so ketamine therapy provides a space for us to do that hard work and to dive into that trauma. And again, that is not always a fun thing. And so the idea that, I've worked with plenty of addicts who come in and do not enjoy the sessions because they're processing trauma, and that's not a fun thing to do, but it's helping them. Yeah, and I also do have addicts who come in and feel like they get a sense of relief. It's not necessarily a bad thing. It's done in a controlled setting, and we are actively working on issues while they're, on the ketamine. And so I have not worked with clients who have become addicted to ketamine, and I have seen great success with clients who have struggled with alcohol use disorders and other substance use disorders. And even though that's not, right now one of the main areas that ketamine therapy is used for, I've worked with plenty of clients where our goal was not necessarily to get to sobriety, but after processing their trauma, they go from being daily drinkers to drinking maybe once a week, and that's a huge win. And that gets them to the space where maybe they then can start to engage in AA groups and things like that, and be supported by the community. And it still is. It does a lot of. It really benefits people. I've seen people addicted to harder drugs who, they might slip up every now and again. That's part of being an addict is, there are relapses from time to time. But again, we're talking about people who are going from daily use, really high risk use, to using, maybe once a week or once a month, or, just getting extended periods of sobriety, which then builds a sense of confidence in them that I don't need this to survive. And I'm not broken. It's not just that AA doesn't work for me because I'm so broken. It's just that I had stuff that I needed to process that these programs just don't necessarily have a great grasp of. And so yeah, I think, I don't know. I think the idea, I understand why people are concerned about, people who have struggled with addiction using ketamine. People often question, me being a ketamine therapist as somebody who is in recovery myself. But I see this as a medication that is helping make the therapy more effective. And it ends up helping clients either, maintain complete sobriety or just get to a space where they are having a healthier relationship with alcohol and find that they don't even really need to have complete abstinence. That's not a guarantee that if you're struggling with alcohol use, that means that you're going to come to ketamine and you're magically going to be able to moderate. Like, I think that it is important for some people to recognize that, there might be certain substances that you do have to kind of have more rigid rules around with yourself. But that also doesn't mean that you beat yourself up if you do relapse. And I think that's another thing with AA. They do talk about relapse as a normal part of the process, but I also think people get so addicted to kind of like the chips, and I have 8 years and I have 2 years or whatever, and I can't go in there and say, I relapsed, because then I'm going to have to give this back and get a newcomer's chip. And there's just so much shame in that. And it just feels, I've worked with so many clients who have talked about just how it makes them not want to go back for help, because they just feel like it seems as if they've thrown those 2 years in the trash. And even though AA doesn't perpetuate that message, in the way that it's written, the way that it can sometimes feel, and the way that in certain circles people respond to it can make it seem like, yeah, you are just throwing that out, and here's all the shame, and you didn't work through those steps well enough, you didn't deal with all of your resentments. And it's like, we're not just talking about resentments here. And also, some of these resentments might be held against people who were very abusive to the person who's trying to become sober. And I personally have had experiences with sponsors who wanted me to make amends with abusers. So I think that's where it's really important to be supported by someone who can kind of help like, okay, like, let's talk about what this process is going to look like and where the boundaries are, because sometimes people who AA has worked for them, they really love the program, and it's understandable because it gave them back their life, and there are great things about the program. But obviously it can be dangerous to make amends to every single person. And disclaimer, the big book does say that you're not supposed to make amends in a space where it could potentially be harmful. But I think not all sponsors are super in tune with that and aware of that, and want you to look at your side of the street and what did you do wrong in that situation, which again can lead to some shame. And so there's a lot of good things about AA, but I just think that I think that ketamine therapy can be really helpful at really helping clients work through some of those just kind of real significant traumas and mental health issues that are keeping them self-medicating.
Yeah, it seems like the general theme of AA is that you just got bit by this alcoholic bug somehow. Mm-hmm. Total mystery. Mm-hmm. But you got it now. And the real trick is to, just stay away from it for forever. Mm-hmm. Now we see a more, kind of biopsychosocial lens towards this, that yes, there may be some genetics associated with this, the way that alcohol is processed, the way that it influenced dopamine, sure. You don't have a lot of agency over those things. Not much of a point in focusing on the fact that there's this significant family history of alcoholism. Cool, we know that. You can't do anything about it. Mm-hmm. You can't exchange your genes or your family history.
Right.
Then there is this heavy connection to trauma. There is something that we can do about that. Mm-hmm. And then there's this social support aspect where a lot of times people who are dealing with, alcohol issues, it's so common when you talk to them about like how this is for them in the household, how there's this other piece that they're either hiding it, or they're kind of in this dynamic where, there's something else there about, the way that they're supported in this issue. Mm-hmm. And so there's a whole other aspect of this too. And so that is a thing that is good about AA, is that community and that support that 100%. Is a huge aspect of getting to a better spot and being supported around those relapses. But just from a sheer mechanistic standpoint, when we look at alcohol being so useful to regulate the nervous system in PTSD and being a really effective treatment in that way, and so that's why it's so widely utilized, PTSD itself remits. And so even when you treat PTSD, sometimes we actually see the nervous system starting to try to respond again in some time like it was. And so a lot of times with people who have PTSD and complex PTSD, we will need sessions through time when those happen. And so it's actually just mechanistically very logical for someone to experience, noticing that they need to drink again as this is happening through their treatment. And so if there's a lot of shame around every single time that somebody actually finds themselves drinking again, for me, that's just more of a marker where the PTSD is at. And that's all it is. It's just, okay, we're starting to see an increased need for external means to regulate yourself. Cool. That means that we need to continue this work, and we just know where we're at right now. And that's actually a normal mechanistic process in the treatment of PTSD, not something to have shame around. And so, I think just this is the difference between having people who really understand these processes in a deep level versus, a lay person, just kind of trying to help you with your process with what helped them when they don't have the same history. Maybe they don't have the same, history of trauma that you do. And so their process just looks really different, for what helped them to stop drinking and to, continue that sobriety. For plenty of people, they go to a meeting a couple times a week, they talk a little bit about it, and that's just all they need for the whole course of the whole thing, and maybe they pray or whatever it is that's really useful in their process. For other people, they've got a whole other mechanism going on they may or may not be aware of, and when they're finding themselves having that increased need for drinking, there's really something there, and it's definitely not something to just have a bunch of shame around. And so,
Right. Yeah. I think AA focuses a lot on character defects and kind of, what's wrong with you. And I think that there is an important aspect to that. You can't blame the world for your substance use. You do have to kind of take ownership over those things, because the world is never going to be perfect. You're never going to be able to have that control. But for a lot of people, they're not, what their main struggle is not these character defects. It is significant trauma and significant suicidal ideation and all of these other things, significant depression that is debilitating. And so the only way that they can sometimes participate in life is by using substances. And then at some point, obviously, the substances stop working or start to create health issues or issues in their families and stuff like that. And so that's when they look for help. And I think that ketamine therapy is a great space to look for help. When you are in a clinic like this.
Yeah, it's upsetting too that a lot of people who are actually involved in AA or NA, they go through KAP treatment. They can't actually talk about that in a meeting, without everyone just kind of being like, whoa, you're just using, instead of actually realizing they're engaged in this process. But just, I'm thinking maybe a final thing to visit here. You just kind of talked about suicidal ideation. I don't really think that we've talked a lot about, the whole suicidal concept, what's going on in America right now at all on the podcast. And I'm kind of curious to share some insight, I guess, because I haven't ran the data in a while, but the last time I did, somewhere around 75% of our patients come in with some degree of suicidal ideation. That might be something that's been there for a very long time, and it's just really passive. When I get stressed, that kind of happens for a moment, and then I kind of move on, or very pervasive, or people who are really kind of very close to, in fact, actually completing suicide. Somewhere in that degree. And then we also have a lot of people who may not elect on intake that they're having suicidal processing, but certainly are.
Right.
And you have now, I don't have a number on it, but you've had a number of cases that we intaked with people who were definitely on a path to complete suicide in the near future if they didn't get treatment.
Right.
And who now, we haven't lost anybody, let's put it that way, and have had multiple people have tremendous recoveries and aren't suicidal at all now.
Right.
Did you think at this stage of your career you would have had that many cases like that? Because that's what a lot of therapists will experience over their entire career, what you've just done in the last year.
Yeah. I mean, I think, the previous work that I did in internship, I worked with really high acuity cases, like really high level of distress. And so I kind of started off working with kind of some of the most challenging populations that you can work with. But yeah, I don't know that I necessarily expected by any means it to look like this. And, I think it's an important thing for people to be able to talk about. And it's something that ketamine therapy is really effective for. And, we again, there's risk reduction that we do. I make sure that clients, have no weapons in their house before we get started, anything like that we can do to make sure that they're safe. We always come up with a safety plan. But what seems to be so helpful for clients is having a space where they can talk about it without being afraid that I'm going to, immediately call a mental health officer to come pick them up and take them inpatient. Because sometimes people, I think, get so scared around this topic that they jump the gun, and the second a client starts to open up about having, these thoughts that, maybe they don't have any real intention yet on acting those out, but have started thinking about methods, that doesn't mean that you need to immediately seek inpatient treatment for that client. There are other steps that you can take first, like safety planning and making sure that they, have the numbers that they can call if there is an increase. And so we do all of those things to make sure that they're safe. And then just provide a judgment-free zone for them to talk about how challenging it is, and to talk about the fact that they do want to kill themselves. And that's a hard thing to talk about in therapy, because there's always that fear of, are you going to overreact and misinterpret what I'm saying and have me go inpatient? That's not what I want right now. And so I think it's been incredible to just watch clients have sessions like that. And I'm not gonna lie, the first few times I had those types of sessions, it was a little nerve-wracking for me to just sit there with a client and let them talk about how much they want to end their lives. And the part of me that just like wants to soothe and take that away immediately and just be like, no, but you have so much to live for. But that's not what they need to hear in that moment. They just need a space to talk. And usually once they do that, there's just this immense relief afterwards of just like, I got that off my chest and I felt so supported in this, and the level of distress just goes down significantly. I mean, I've worked with several suicidal clients, and recently, after maybe 4 sessions, had a client tell me that they went from thinking about suicide almost all day, every day, to having only one thought of suicide in the past week. So this definitely, I mean, I've seen it time and time again where I've worked with clients who are coming straight from inpatient right after an attempt, and we work on, addressing whatever it is, some of the suicidal ideation, whatever's the root causes of that are, and by the end, it's not something that they're struggling with anymore. It's not they have a newfound kind of desire to participate in life, and so that is an incredible thing to see for sure.
Yeah, the way I see it, having been involved in this for just this period of time, and looking at, data every year on just what's going on with suicide rates in the United States, it's like hockey sticking right now. It's just escalating so fast, and a lot of drug overdose deaths related to fentanyl. That's a big reason why it's like really upticking. So, but we've had just hundreds of cases of people who come in who are extremely suicidal, and then a month and a half later, that's just not on the radar anymore. And I guess when I was looking at the data of how many people in Austin completed suicide in 2019, and then I looked at 2020, which our clinic in 2020, we saw so many suicidal people. There was a massive increase in the amount of people who, in the early lockdown phase of the pandemic, were extremely suicidal. also, they didn't want to go inpatient. I mean, most suicidal people don't want to go inpatient, but they were very opposed to going to an inpatient where you're there with a lot of other people who could potentially have COVID. So they didn't want to do that. And I kept hearing repeatedly from a lot of patients, my therapist is not answering my phone calls, my psychiatrist is not answering my phone calls. I think they were overwhelmed with everybody who was incredibly distressed. And so, and the providers were distressed themselves. And so there wasn't good management of the situation. So all of a sudden we found ourselves intaking just droves of suicidal patients. And the crazy thing is I wish I had pulled the actual number, but there was actually a reduction in completed suicides in Austin in 2020. And I know that we saw a bunch of cases that year and brought them to subclinical. And so I was like, even though, and I'm not claiming that in Austin we single-handedly reduced this number by ourselves, but I know for a fact that even though there was much more suicidal patients in Austin in 2020 than there were in 2019, we got started just right before the pandemic, like 3 months beforehand. Even though there was that difference, there was actually a 16% decrease in the amount of completed suicides in 2020. And I can't help but feel that is 100% because of all the people that we saw that year. Because it wasn't the inpatients. And I heard repeatedly that people's providers were letting them down.
Yeah.
And so I didn't expect when I started a ketamine clinic to be making an impact in the total amount of people in a given city that actually complete suicide. I didn't know that's what we were going to be doing or focused on. I thought that we'd be treating people who were depressed. And I thought people who were depressed because maybe they had lost their thirst for life, their sense of adventure, just lost perspective. And I thought that's kind of how we would be, kind of working with people and, just also helping people get back in better habits and everything like this. And all of a sudden I found myself in a completely different mission.
Right.
And the crazy thing is we haven't seen the intaking severity of our patients decrease from when it went up in 2020 in the initial lockdown. So I don't think that this is something that I have a perspective on as somebody who works in a mental health clinic, but the world improved after we weren't in lockdowns and a lot of things like that. The mental health didn't.
Right.
It got bad, it spiked up, and then it just continued on. I know for a fact because I have data before the pandemic and I have data as it spiked and I have data now. It's not any different than it was during the middle of the lockdowns. We're still seeing people who are tremendously suicidal. We're still seeing the big increase in drinking, all of the things that spiked during the pandemic. Now we're in a whole new set of trying times at this point. This last summer, this last year has been real wild for a lot of people. But I guess one of the things that I've seen to be most significant in helping people with suicidal ideation is being able to provide a place where people can actually talk about it. A lot of times, this part of them that feels this way, that is so out of control and so stressed and has no solution, and is dealing with every single day that goes by getting a little bit worse,
Right.
with no immediate solution. It is a completely logical process to think, maybe I just shouldn't be here anymore. If that doesn't come up, there might actually be something wrong with somebody when life is that bad.
Yeah.
And the challenge is if they go to try to talk about this with anybody, if they try to go talk about it with a layperson, chances are they're going to be met with the exact opposite of what they actually need. And if they go talk about it with a professional, they might end up impatient. So we've always tried to have a culture of, you can talk about anything here.
Right.
Now, if you're telling me, if you let me go home right now, I'm going to go kill myself.
Right.
Well, you're kind of spelling out a picture where, yes, let's try to get you some, help in a way that's not going to happen. Because I know you told me on intake that you didn't want that to happen.
Right.
So let's work together to figure that out. But, unless that's the situation, which that isn't the situation, most time people who come to us and are suicidal, they don't want to complete suicide. That's why they're here.
Yeah.
So the thing is we've always tried to create this space where people can actually talk about it. And just even that process of being able to get it out there, the actual depths, the actual despair, just exactly how bad it is, all of the elements around this process, how they want to do it, what's been going on in their head. A lot of times when that part of them that processes things that way, that may have been there for a really long time, or maybe is just kind of coming out right now, it becomes unburdened and it sets aside, and maybe they can start thinking about, well, at least I could do this. These other parts start to speak a little bit better. And so the challenge is that when someone's suicidal and that part is saying, hey, this is what's going on, and they're met with like, oh, but you have so much to live for and everything else, that is not what that part needs at all in that moment.
Right.
That part needs to unburden itself. It needs to explain what's going on and be heard to its completion until that part got it off its chest, and then a lot of times after that happens, it can kind of set aside. And so yes, ketamine might have some, chemical actions on suicidality, and there are those, those aspects of it. But if you're actually in the session with somebody who's suicidal and they're talking about it, this seems to be the process. And so anyway, I try to have everybody here have a culture where you can talk about anything here. And so that's not a common thing, in mental health. And so a lot of times people who, vocalize their suicidal ideation are honestly treated like a criminal for having had thoughts.
Right.
And the thought police come out and put people away. And that just doesn't make any sense to me.
Right.
So, because I see that coming from a bunch of people who are very insecure about their own mortality, who haven't processed their own stuff, and they're terrified about their sense of their own death. And so when they're faced with somebody who's talking about, this process, they just can't understand it, does not compute, and they don't know what to say about it, how to support it, and they've never experienced it themselves. And so they just simply don't know how to help that situation at all. And I actually see suicidal ideation as not a very difficult process at all to treat. It just provides a space full of people who actually know how to treat it.
Right.
And aren't going to just lock people up, because that's the challenge of, trying to be able to talk about this. And we do it in the outpatient setting, where it is the case that people go home after treatment, So anyhow, I guess I don't know how to tie all this up between complex PTSD, alcohol, addictions, what's right and wrong with NA, and treating suicidality with KAP. But I think the last fun question, why do you think I hired you?
Oh, gosh.
Yeah.
I mean, okay, I guess I'll give a serious answer. Probably because I do have, despite being, an associate and relatively new in this career, I immediately jumped in an internship to one of the most challenging populations you could work with. I have more experience working with severe mental health disorders than most clinicians, especially at this point in their career. But, a lot of clinicians don't really ever get the opportunity to work with those populations. And so I think I started off, like really kind of learning what those challenges were, how to, engage in self-care so that I was not burning myself out through that. And it's something that I'm really passionate about. It's something that this job fuels me. Clients often ask, how do you sit here and hear these stories all day? But I think when clients ask that at some point in their series later, when they're doing better, I kind of remind them of the fact that, like, remember when you asked that? This is why. So it's something I'm really passionate about. It's something that fuels me. It's something that I have, some experience I'm not a master of treating these conditions by any means, but I think, I do an okay job at it. I feel like I've been able to form really strong relationships with the clients that I have where they do feel safe talking about these things with me, which I always feel very, honored and humbled and blessed when clients are willing to open up with me. For whatever reason, I have been able to kind of create that safe space for clients.
Yeah, when you came out, there's always this interesting phenomena with certain therapists where, they kind of either have it or they don't, basically. If ever I find that I'm about to start oversharing and I barely know somebody,
Mm-hmm.
that's obviously a good sign.
Mm-hmm.
Just had beginner's mind. You were like, I'm all ears, for this. And that is a extremely important trait in this because it's a new field.
Mm-hmm.
And so we're all figuring this out together. And yes, we have a little bit of experience doing it, but eventually there's going to be a case that none of us have, and we're going to have to put our heads together and figure out what somebody needs.
Mm-hmm.
And so being in this new process, beginner's mind is critical.
Mm-hmm.
So you're very humble despite your experience. You also had a sense of adventure. And so open to take on big challenges.
Mm-hmm.
And you had your own experience in regards to your own challenges and the passion. So I just think that between all of those things, I had an insight that you were probably going to kill it once we, got you rolling and you'd learn fast. But what's wild is, so then you see a number of cases, and I ran your OQ45 data, and it was 86% of your cases went from the inpatient mean to subclinical when I ran it, before the data got all wacky when, because it can do that over time. But I was like, holy shit, I think Emily actually just had the highest success rate of any therapist that we just had. She's right out of school. And so, point being, for whatever reason, you have it. And I don't know. The main thing that my goal with Emily is not burn her out. I want her to have a really long career, because when someone's this good, you're just like, oh yeah, Emily's got that case. Emily's got this case. Next thing you know, you're just like, you have a very short career for a therapist. So I'm like trying to protect, her as much as I can, to meter out, how much work she's doing, because it's hardworking. So anyway, that's the first one we did.
Yeah.
I knew if I got you talking, we'd come up with some cool stuff. So
sure.
We'll figure out some other stuff to talk about.
Mm-hmm.
And if you want to work with Emily, 833-313-2512, or email info@transcendketamine.com. You can read her bio on the website, but you pretty much just heard a whole lot more about who she is anyway.
Much more detailed.
So how do we close it? I never have come up with anything.
Oh gosh, I don't know. We need like a slogan. Yeah, we need like some kind of like. I'm not good at coming up with.
That's why I needed that recorder.
Yeah.
Yeah, I actually like Until We Meet Again.
Yeah.
Because I believe in non-duality. Mm-hmm. And so I believe that when we die, we all remerge into the exact same consciousness. So it's a little bit of a deeper meaning for me than other people. Yeah. But anyway, until we meet again.
Yeah, until we meet again.